Thanks, Kyle. And more than 5 million cases of skin cancer are diagnosed in the United States each year. It's America's most common cancer, but skin cancer is also one of the most preventable forms of cancer. And joining me this morning from Gundersen Health System is Dr. Kurt Edel. Good morning. Thank you for joining me.
Good morning. Thank you for having me.
So is skin cancer getting more common or is it getting worse?
Yes, so we know over the past 30 years that the incidence has slowly been rising. It's most common in elderly men. However, it's the most common cancer in young adults ages 20 to 29. So yes, the incidence is increasing. There's been about 100,000 cases of melanoma, the more lethal form of cancer, each year, with about just over 7,000 deaths.
And there are different ways to prevent skin cancer, like wearing hats, covering exposed skin, and of course sunscreen, which people didn't use as much as they use now. So what is your take on the benefits of sunscreen?
Yeah, well, right off the bat, I'll tell you I'm a big fan. We know that one of the biggest risks for melanoma, and again, that's the more concerning of the types of skin cancer, but we know that that can prevent particularly the severe sunburns, the blistering sunburns that are actually one of the biggest risks for melanoma. So yes, absolutely.
And when do we seek an opinion of an expert, on a mole or something questionable that we can see on our body?
Yeah, so I like the what's called the ABCDE rule. So when looking at a mole, look at A, is it asymmetric? B, does it have irregular borders? C, is the color changing? D, is the diameter bigger than a pencil eraser? And E, is it evolving over time? I think that's a good rule to follow.
And what about checking for skin cancer? Are there any other things to just be aware of and keep on track of as we head into the summer months?
I think the biggest issue is just being aware of any moles that you have and noticing if there's any change. If there is, I think that's a great opportunity to bring up to your primary care physician. So just being aware.
Well, thank you so much for joining me this morning.